Our top story, depression and suicidal thoughts are just some of the symptoms of the little-known condition Adult Attention Deficit Hyperactivity Disorder, or ADHD. And yet patients in some parts of our region are waiting for up to 2 years for diagnosis and treatment.
Yeah, now a Yorkshire-based charity which helps those struggling with the condition says the wait times are putting lives at risk. Nicola Rees has our top story.
ADHD nearly killed me, it nearly claimed my life. You know, I was suicidal. How many people have lost their lives because they haven't been able to access the treatment?
I asked if I could get some assistance from Adult ADHD services, and his response was literally to laugh in my face and basically say, adults don't have ADHD, you should have grown out for it by now.
Symptoms of ADHD can include inattentiveness, impulsiveness and hyperactivity. It's often associated with children, but it also affects around 1.5 million adults. Stephen Spencer from York seems an unlikely ADHD patient. He's professional and calm, but the condition has set back his career in finance.
It's not that you speak too much or you're fidgety, it's just the fact that maybe because you have less of ability to retain information, then they would have to explain things more and over again. You know you're not an idiot, but you're treated that way. And that in itself is soul-destroying.
Stephen was 42 when he was finally diagnosed with ADHD.
I first started asking questions when I was 25, and I got a diagnosis about Christmas 2016. I've been to GPs backwards and forwards, on and off, all over those times.
Fewer than 8% of adults with ADHD have a formal diagnosis. This clinic in Leeds has one of the shortest waiting lists, but across the country people face long delays to get the help they need.
There are huge variations in services depending on where you live. Here in Yorkshire, you'll be waiting anything from 6 months to 2 years to see a psychiatrist who specialises in adult ADHD. And for many people, that's too long.
If we look at all of the available evidence, what we see is that ADHD is connected, for example, with higher rates of suicidality, higher rates of depression, and higher rates of other mental health needs. And this, in addition to the fact that untreated ADHD can impact on your physical health, means that people can be in a very serious condition while they're waiting for ADHD treatment.
Some of those people are being supported by a charity in Harrogate. Its founder, Michelle Beckett, knows the difference a diagnosis can make.
Absolutely life-changing knowing that I had ADHD, so it just explained my whole life. The medication has been tremendous as well, and it's just kind of calmed down the impulsiveness and the racing thoughts.
In a statement, the Department of Health says early intervention is essential in supporting anyone with ADHD, and the National Institute for Clinical Excellence recently updated guidance to make it easier for doctors to spot and diagnose the condition. But Michelle wants ADHD to have a much higher priority. She's now formed a campaign group which demands equal access to support services.
People are contacting me saying we've been on the waiting list for 3 years, and we have heard of wait times of over 7 years in some parts of the country. This cannot continue because people are suffering.
As a society, we are not dealing with this effectively at all. There are huge swathes of the population who are essentially being missed out by the education system, by the medical system, by everything.
NHS consultant Marius Adamu set up the first service for adult ADHD in Yorkshire in 2009. He's now the clinic lead in Wakefield, Kirklees and parts of Barnsley. Marius, you were nodding along in agreement with a lot of what you were seeing and hearing there. How difficult is it to diagnose ADHD in adults?
It takes a trained professional to be able to diagnose ADHD in adults, take an appropriate history. So there needs to be an element of familiarity with the presentation of the person. So in terms of difficulty, a trained professional can do it.
As we were hearing there, some GPs didn't recognise ADHD. Could it be that there's a lot of people being treated for something else?
It can be, and the NICE guidelines mentioned earlier do not recommend that GPs make the diagnosis, but GPs would not know if the service users or the people presenting to them have the diagnosis. So they could be treating people for anxiety or depression where the core condition is adult ADHD, and that would be missed.
And where on the spectrum is ADHD when we're talking about mental health as a whole?
It is a developmental disorder, so people are born and develop the condition as they grow up. For some people, they grow out of it. For a lot of people, they don't, and it is for these people that services need to be developed more to be able to accommodate them. So then there is no waiting list, as we have seen earlier today.
22 months for Kirklees. How can that be, to wait that long to be seen?
From tomorrow, there will be an initiative regionally to try and address these difficulties and these long waits. It is a matter of the knowledge and the investment catching up with the capacity that there is in services. There is a bit of a gap. In Yorkshire, we have the largest services. We are ahead of other people. This is why we have the waits. In some areas, we would not have had the waits have we not had a service. We are working quite hard and for some time to be able to address this issue, and we are working on it.
Just very quickly, how much of an effect can it have on adults who are waiting a long time to be seen?
From a waiting list, as normally about half of the people may have the diagnosis, the effect is not so much from the waiting alone, it is from having the condition that it has been untreated. So, and this is where I think the challenge is, in getting people through quickly rather than anything else.
Marius Adamu, thank you very much for joining me.
Thank you.
Well, we'll have more on this in our late programme as part of the BBC News at 10, where we'll be asking the House of Commons all-party spokesperson on ADHD what more can be done.